Hi, my name is Valerie Rosenberger, and I'm a physical therapist assistant with Cone Health. I've worked in a variety of clinical settings since 2005, and more recently have been specializing in cancer rehab since 2012. In cancer rehab, we specialize in working with patients at many different times during their treatments. We may even see patients multiple times during their journey, as we can help smooth out the road to their recovery. I want to cover a little bit about what cancer rehab is, because for most of you, this is the first time going through something like this. So you don't know what to expect, and our goal is to help you through it. Some of the most common things that we focus on is helping patients to regain their range of motion, their posture, and their strength after surgery. We also work on leg strength and balance if there's a weakness or neuropathy after chemo. And of course, we treat lymphedema, which we will discuss in this class. We tailor our treatments to each individual patient and their individual needs. Most of our patients have had breast cancer, but we also see patients with other types of cancer. During your recovery, I want to encourage you to please listen to your body. If at some point something doesn't look right or feel right, tell your healthcare provider. It has happened too many times over the years that a patient finally gets to us and makes the comment that they wish they had mentioned their symptoms sooner to their healthcare provider so they could have sought help sooner in their recovery, allowing for a relief of their symptoms sooner. Now that we covered what we do at Cancer Rehab, let's get to talking about lymphedema. What is lymphedema? To better describe this, I think it's easiest if we break the word lymphedema into two parts to help you better understand its meaning. The end of the word edema means an abnormal amount of fluid in a particular area. This is typically not normal and due to some type of trauma, like if you have an ankle sprain. The beginning of the word lymph means the abnormal swelling is found in your lymphatic system. Also, lymphedema is a chronic and progressive condition if left untreated. As you now know, you have a cluster of lymph nodes in each armpit. The lymph nodes are filters for the lymph fluid that moves through your arm and breast on the side that the lymph nodes were removed from. If the lymph nodes that are left can't keep up with keeping the lymph fluid moving, it will begin to back up in the same side, arm, or breast. To help you know exactly where you are susceptible to developing lymphedema, I'm going to explain the lymphatic system in just a bit more detail. First, understand that the lymph vessels that the fluid moves through and gets backed up in when lymphedema starts to develop are super superficial. We're talking directly under your skin. Try right now to touch your upper arm, around your bicep area. Almost as soon as you place your fingers on your arm, you can feel the muscle underneath, right? Well, you've already pressed past the superficial lymph layer. Crazy, huh? The lymph vessels lay on top of the muscle, and that is where the lymphedema will occur. So when we get to the treatment section, understanding how superficial the lymph vessels are will help you to grasp the concept of why the manual lymph drainage is so light. We also know that each armpit has its own cluster of lymph nodes, and so does each inguinal or growing area. So picture your body split up into the 4 quadrants by imagining a line right down the middle of your body, dividing it into right and left sides, and then across the middle like a belt at the level of your belly button or your umbilicus, dividing your body into up and down. Now, the side where your lymph nodes were removed from is the upper quadrant that you are susceptible for developing lymphedema. If your nodes were removed from your right armpit or axilla, your right arm, and any breast tissue, if you didn't have a mastectomy, the side of your trunk, and your upper back is where you could develop lymphedema. As we discuss the upcoming risk reduction habits, take into consideration that I am only speaking of your affected quadrant. What's your risk? Now that we've covered what lymphedema is, and you now know where you are susceptible to developing lymphedema, let's cover what your risk factor is. There are 2 classifications of lymph node removal. The first and most common that we see is a sentinel lymph node biopsy, or SLNB. You'll see that in your chart sometimes. The other is an axillary lymph node dissection, or ALND. Allow me to explain the difference between the two. You have anywhere from around 20 to 30 lymph nodes in each armpit. When you have an SLNB, that means you likely had 7 or less lymph nodes removed. Most studies say that your risk of developing lymphedema runs around 5 to 9% or less than 10%. If you had an ALND, that means you had more than 7 plus lymph nodes removed. That number could be 10, 15, or all of them. Your starting risk here for developing lymphedema is around 25%. We also need to consider the increased risk of lymphedema that radiation may cause to either the breast or the arm. Radiation itself can increase your risk to developing breast lymphedema since the radiation is directed specifically to the breast tissue. The superficial lymph vessels under the skin can become damaged from the effects of radiation. This may be temporary or permanent depending on the extent of the damage to the tissue. Only time will tell. And the time frame you could develop breast lymphedema could be as soon as during radiation or up to many months after, because it will take your body that long to recover. The other way radiation could affect your risk is if your armpit has to be included in the radiation field. If you're not sure about where your radiation field, which is what we consider the area that's being radiated, ends, then ask your radiation tech at your next visit. If you've completed radiation already, you can ask your doctor at your next visit, or of course, you could always just call the radiation oncologist's office as well. You see, the purpose of radiating the lymph nodes would depend on your diagnosis. The staging, progression, and aggressiveness of your specific type of cancer is how they determine how much radiation and where. They don't want to include your armpit in the radiation field because the doctors know it will increase the risk of lymphedema. So if they have to, it's for a good reason. Some signs and symptoms of lymphedema. There are 4 stages of lymphedema. We categorize them from stages 0 to 3. Here's what each one looks like and what you can expect to find if you start to develop it. Stage 0, what will it look like? Well, the initial signs of stage 0 are actually not a scene, but a feeling of achiness or heaviness in your limb. Because it is getting heavy, fluid is starting to build up in either the breast or the arm, causing the feelings of achiness or heaviness. We call this stage 0 because you have a very slight increase in the amount of lymph fluid in your limb, but no visible swelling as of yet. This amount of fluid is so small, it's not even a measurable circumferential difference with a tape measure. It is detectable, though, if you are coming for your every 3-month SOZO screens with us. The SOZO is a machine that uses an electrical current, the amount in a AA battery so you don't feel it, to detect increased fluid when compared to your baseline measurement if we were able to get one from you before surgery. Stage 1. This is when you have spontaneous reversible swelling, most commonly in the lower aspect of your limb, like your hand or your forearm. An example is when you wake up one morning and you see there's a little bit of swelling in your hand or your wrist. You can no longer make out the tendons or the blood vessels in the back of your hand. However, later in the day, the swelling may be gone, hence spontaneously reversible. If you start to develop this stage of swelling, the first thing you do is stop and try to think of what you did in the last 12 to 24 hours that could have possibly caused your lymphatic system to work harder than it's been able to work. Perhaps you were in your garden the day before and you stayed out a lot longer than you had planned, and it was really hot that day, and you were really pulling hard on the weeds. It could be that you just did a little bit too much, and your body is letting you know in the only way that it can. You don't have to stop working out or doing your hobbies like gardening, because you will not hear that advice from a physical therapist to stop working out. But you could try scaling back a bit to gauge your body's reaction again. Perhaps lighter weights next time at the gym or doing less repetitions. If it was gardening, just try not to stay out so long and not doing it in the heat of the day. Those are just a few examples of ways that you could have done something that caused an increase in the swelling. If you make those adjustments and see no further swelling, then congratulations. You listened to your body, figured out what was too much, and made the appropriate adjustments. This is a good example of where I like to encourage my patients that having lymphedema or trying to prevent yourself from getting it is not a life-stopping event. It's just a life-altering one. Now, if the swelling continues despite any changes you've tried, that's when it's time to seek out help from a certified lymphedema therapist like myself. It may be that it's time to start treatment, but we'll discuss treatment options in a few minutes. A few areas that you can look for this swelling is to first compare the backs of your hands. Can you still see the blood vessels and tendons in both? Now, what about your wrist? Can you make out your wrist bone? Is the circumference and shape of both your wrists similar? One other little trick to see if there's any swelling hiding further up into your forearm is to stand in front of a mirror and bend both your elbows so your hands are near touching your shoulders. Now you can see the back of your forearms in the mirror. Did the width of each stay the same, or is your affected side a little bit wider? These are a few ways to see if you can detect any early swelling. Stage 2. In this stage, you start to have spontaneously irreversible swelling in the limb, meaning that it is going away, but less and less. You may also start to notice some tightening of the skin as the tissue is becoming firmer to the touch underneath your skin. This is called fibrosis, and you start seeing it at this stage. If your swelling has gotten to this point and you have yet to seek care, please do so immediately. It will continue to worsen if you don't do anything about it. And I've seen that in patients over the years who were in denial and honestly just didn't want to deal with it or be told they had lymphedema. But I promise you, if you try to ignore it and hope that it will go away, it's actually more likely that it will get worse. Lymphedema does not typically mean you have a cancer recurrence, so don't let that be a fear. It is almost never related to your cancer, but the fact that you had lymph nodes removed. So don't let those fears keep you from seeking help from your healthcare provider. At stage 3, this stage is most commonly seen in the legs and very rarely in the arm. In this stage, you not only are having the fibrosis continuing, but it's becoming more of an issue because now you also start to see skin changes. The swelling no longer goes away at all, and your limb typically has lost its natural shape. If you still haven't sought treatment, please do. We won't be able to get your limb reduced back to its original size at this point because the skin and tissue changes have gone on for too long. However, we can improve the health of your limb. If your limb has stage 3 lymphedema, it is at a higher risk for developing cellulitis, which is something we're going to discuss. Most patients we treat are between stages 0 to 1. They've started to notice swelling, but it still comes and goes, and this is the best time for the best results of treatment. Let's next cover skincare and infection prevention before we jump into treatment options. Skincare and infection prevention. It's important to keep in mind what you've learned about how superficial the lymph vessels are for this next section. It will help you to understand why taking such good care of your skin can help prevent or lessen your risk of developing lymphedema and infection. Because you've had lymph nodes removed, you are at a slightly higher risk for developing an infection called cellulitis. Cellulitis is usually a superficial infection of the skin and requires treatment by an antibiotic. If left untreated, cellulitis can be life-threatening. So how do we avoid this? Well, first we try to protect our skin with things like wearing sunscreen when you're spending prolonged time outside during the summer. If you love that gardening we talked about, make sure you wear long sleeves and wear your gloves. Bug repellent if you're in an area where you know mosquitoes run rampant. It's a simple matter of being consistent with the things that we generally already know to do, but we just may not do them regularly or every time we step outside. Any opening in your skin can put you at risk for an infection. On the other hand, just because you have an opening in the skin, that does not mean you're guaranteed an infection. Many times, the lymph nodes left in that area do a good enough job to prevent an infection. Now, let's say you've done everything right and you still get cut because it's going to happen at some point, right? I always tell my patients that before you freak out and worry about an infection, try to think of 2 things that can help you to determine your risk for the cut or trauma developing into an infection. The first thing to think about is the environment that you got cut in. And the second is how bad is the cut. Sometimes these 2 factors can help you determine the seriousness of the situation. I have seen small cuts become infected and larger cuts not get infected. Some of that was affected by the care received during that time. Here's 2 examples to better help you understand. Let's say you're washing dishes in hot soapy water and you nick yourself on a steak knife. Or were you in the garage and you bumped into a rusty saw blade that filleted your forearm wide open? Well, in either example, the first thing you should do is the same. Clean the area with soap and water as soon as possible. Already done in the first scenario, you were washing dishes. And then work to keep the area clean and dry for the next few days while it takes time to heal. If it's going to become infected, it won't be immediately. It would normally happen a few days later, but could also be a bit later than that. You see, when you first get cut or experience some kind of trauma, like a burn or a sunburn, your body reacts immediately. Your lymph nodes in your armpit of the injured side receive the signal that something is wrong, and they in turn start increasing their production of white blood cells to help heal the area. Next, the lymph vessels absorb the extra fluid at the area of trauma, so now these large molecules of waste are absorbed into your lymph vessels and begin their journey back to the lymph nodes for filtration, and eventually make it to the deeper aspect of your lymph system and your kidneys, so your body can rid of the excess waste through your urine. This is your body's natural reaction to trauma. What happens if there aren't enough lymph nodes to produce enough white blood cells to counteract the trauma? Or what if there's already some swelling that has been accumulating in your forearm and the lymph vessels can't absorb the fluid to move it back out as quickly as needed? That process of not functioning well enough can take up to a few days. And if there's a problem like that, that's when you start to begin to see signs of an infection develop. So what would it look like if it started to become infected? To just say redness would not be descriptive enough, because redness is actually normal at first, along with a bit of swelling. Think about the last time you got a paper cut on your finger. It felt a little bit tight from the swelling, was probably tender, and had some redness to the area, right? That's your body's natural and normal reaction that's trying to heal the cut immediately. Now, if that redness were starting to spread, or perhaps angry-looking streaks began to show at the area as well, if you're not sure if the redness is spreading, you can grab an eyeliner and trace the border of the redness as closely as possible, and then go back and check it again after 1 to 2 hours. Is the redness now outside of your line? If yes, then it's definitely spreading. Is there drainage with an odor, more pain than you'd been experiencing? Perhaps you're starting to not feel well, like you're coming down with a flu or a fever. Any or all of these symptoms can be an indicator that your cut or the area of trauma is transitioning to an infection. It's at this point that you need to call your doctor's office, or if it's after hours, you got to get yourself to an urgent care and emergency room. Because think about the eyeliner and seeing the redness expand within just a few hours. Now imagine how much worse it will be if you decide to just wait until the morning many hours later. That is when it can become more of a serious situation. It isn't often that people are hospitalized for cellulitis because it is so easily treatable. However, if left untreated, it will worsen fairly quickly. And if you're just not sure, nowadays so much of our healthcare is done virtually, this can be one of those times that works in your favor. I've had patients, and we've done it for patients as well, that we can just take a picture that we can upload directly into your chart that your doctor can see. So if it's during the day and you can get a hold of your doctor's office, that would be a quick way to get an answer about yay or nay to infection. Just please don't ignore it. A few other skincare tips to help you out are trying to avoid prolonged sunlight to prevent sunburn, and you'll be sensitive to it for a while anyways after radiation. Avoid blood draws and blood pressure checks on the affected side as able, and using moisturizer during the winter. If you're like me and your knuckles get super dry and crack and bleed, well, that's another open avenue for infection. As far as trying to avoid having the blood drawn and the blood pressure checks from that arm, research doesn't prove that having blood draws and blood pressure checks are directly related. However, due to our experience, we suggest you try to avoid this for the first 2 to 3 years, because why not? If you had lymph nodes removed previously from your other side, we recommend using your older side for blood draws and medical procedures. If they were taken on both sides at the same time, use the arm with the least number of lymph nodes removed. Also be careful about using heat or ice as well. If you have an injury that requires ice or heat, just know that changing the temperature in that arm can increase blood flow to that arm, which can stress your lymphatic system. You can use a thicker towel than you would have used before to help better control the temperature. If you're careful with not heating that particular body part up more than your daily shower, you should be okay. And with ice, yes, I know it slows circulation down. However, when your tissue thaws out, you have that rush of fluid coming back to the area. So again, there's never a never and there's never an always situation. Just be careful. Now, some treatment options. Now what to do if you've done the things we've discussed thus far and that pesky swelling still won't go away. If you haven't already, find a lymphedema therapist and let us take it from there. The treatment options for lymphedema will vary slightly depending on the stage your lymphedema is when you come to us. There are 2 phases to treating lymphedema. The first is the active phase of treatment, which is where we begin educating and instructing you in more depth about your lymphatic system. The 5 staples to this treatment are skin care, infection prevention, manual lymph drainage, compression, and remedial exercises. The second and final phase is the maintenance phase of treatment. At this point, we transition you into continuing all that we've taught you. You will hopefully maintain the reductions you've gained. This phase continues to consist of the same 5 staples that the active phase consisted of, except we may have changed what compression we're using. What do I mean by compression? Well, there are a few different types. There are compression bandages, compression garments, and bandaging alternatives. Compression bandages. These are used to try to reduce swelling. They look like ACE wraps, but they don't have as much stretch. They have a high working pressure, but a low resting pressure compared to ACE wraps, which are high working pressure all the time. This means that you're able to sleep in compression bandages comfortably. You can't do that with ACE wraps. Next, there are compression garments, like sleeves for your arms or stockings for legs. The garments exert a low working pressure and a high resting pressure. That's reversed from the bandages. So when you are at work, they aren't working as hard as the bandages because we are no longer trying to actively reduce the swelling like we were in the active phase. Now we're just trying to maintain, and they have a high resting pressure. That means that they are trying to return to their original shape, so these cannot be slept in as they can cause a tourniquet effect type force. To get a compression garment, there are a few options. If you live in Greensboro, there are certified fitters that are available to measure you for garments. Please don't order a garment off of a website that doesn't specialize in lymphedema treatment. You're not sure what you're going to get. Most insurance companies do cover garments when you have a history of breast cancer. It's just a matter of finding a medical company that your insurance covers. So you may need to make a phone call to your insurance first to ask where you would be covered for DME, durable medical equipment. You will also need a prescription from your doctor that states that you need a 20 to 30 mmHg, or millimeters of mercury, class 1 sleeve, and perhaps a glove or gauntlet due to your history, and it needs to also notate right or left breast cancer. This is the appropriate amount of compression for prevention, like when flying, for example. The third compression option is what we call bandaging alternatives. These are Velcro garments that are the length of the limb and have multiple alternating Velcro straps that you tighten up the arm or the leg. These are made to mimic the compression delivered with bandages, so they can be slept in. I briefly want to mention wearing compression while flying. There's a lot of back and forth research that shows compression should and should not be worn when flying. Our suggestion, based on years of experience, is that if you've had lymph nodes removed and are taking a flight, we suggest you should get a class 1 sleeve to wear when flying. And if you're going to a hot climate where you'll be doing a lot of walking and activity, it wouldn't hurt to just continue to wear it for a few hours after you get off the plane while you're acclimating to the climate. We've discussed 2 of the other components, skincare and infection prevention already. Lastly are manual lymph drainage and remedial exercises. MLD is a sequence of a very light skin stretch, not slide, with light pressure, redirecting the fluid towards the neighboring healthy lymph nodes. This is something that you should not try to Google at home, and you really should be taught by a certified lymphedema therapist. I've had too many patients come in doing it wrong or incorrectly because of something they saw on the internet, and remedial exercises are beneficial when you are in compression bandages to help further assist the muscle pump we discussed, encouraging the fluid to move along where it was directed by MLD, and where it's further being encouraged by properly placed compression bandages. These are also helpful if you are in bandages and start to experience mild tingling and numbness in the fingers or the arm. Increasing the muscle pumping action will encourage circulation, which can decrease the before mentioned symptoms. Stretches and strengthening, how to safely progress resistance and weights. We've about reached the end of our discussion. The last topic is exercise and how to safely do this without increasing your risk of lymphedema. If you feel you've regained most or all of your range of motion back, I encourage you to stay tuned in for just a few more minutes so you can now learn how to safely progress resistance. It's important to work to regain most of your range of motion back first before you begin strengthening. Otherwise, your technique can be affected, which can leave room for injury down the road. I'm going to show you a few gentle stretches that you can incorporate into your day to help you regain your motion back quicker. I like to use the phrase, sprinkle your exercises into your day. First one is an overhead dowel stretch. You're going to place your affected arm on top of the dowel, and with your other arm, you're going to bend your elbow, lifting your arm out to the side. Once you get your arm up to where you feel a reasonable stretch, but not pain, I want you to drop your shoulder, making sure it's staying down, and hold the stretch for about 5 seconds. Once you've held the stretch, start to lower your arm back down, and continue to repeat that at least 5 times. And if you don't have a dowel at home, you can use a golf club or a broom handle, anything that's long enough to allow you to be able to reach overhead. For this next one, you're going to reach behind your neck, relaxing your arms without pulling on your neck. And you're going to start to open your elbows up until you feel a really good stretch across your chest. Again, making sure to not stretching into pain. This is a great stretch to really help you get ready for your radiation positioning. For this next exercise, you'll want to stand in the doorway. Slide your arm up the door frame until you feel a gentle stretch. If you can tolerate more, you can clasp your hands around the door frame and turn your body ever so slightly away until a gentle stretch is felt. Make sure your shoulder is down so your shoulder's not trying to kiss your cheek. Hold this one again for about 5 seconds. And this is an easy one you can work into your day every time you leave the bathroom. So by the end of the day, you've done this one quite a few times. This next stretch is good for your whole chest. You want to stand in the door frame, maybe a little behind it depending on your tightness. You're going to slide both arms up the door frame to about shoulder height, but the level depends on your chest tightness. And you're going to put one foot in front of the other and slowly shift your weight onto your front foot. Slowly shift your weight. Don't go fast. It'll be a big stretch quickly. Here, we're stretching your pec muscles, which are larger. Hold for about 20 seconds, and then just shift your weight back onto your back leg. For this one, you only need to do 2 to 3 reps at a time. If you've had a mastectomy, please wait at least 4 to 6 weeks before this one, and or until your incision is well healed. Do not stretch a still healing incision. Sometimes after your surgery, your scar tissue can be really tight and can be part of what's limiting you regaining your range of motion after your surgery. You can use your opposite hand to move the skin gently up or down, side to side, but not until it's well healed. And using vitamin E oil, coconut oil, or cocoa butter with vitamin E are a few examples of moisturizers that you can use to help aid healing and possibly lessen your scar tissue. Once you've regained most of your motion, you can now transition into strengthening your shoulder. This is where the low and slow mindset comes in. When you exercise, you're increasing your muscle pumping action, which draws fluid into that muscle. So if we progress the resistance and reps low and slowly, it gives you time to assess your limb as we discussed earlier. A simple example is to start with maybe 1 pound, 1 set of 10, if you're doing a few simple strengthening exercises. You only need to strength train 2 to 3 times a week. So if you do this for 1 week, then you've done the exercises 2 to 3 different times. How is your arm and breast feeling after? Any heaviness or swelling? No? Great. Then you can continue to progress to 2 sets of 10, still staying with the 1 pound. Do that a few times. Things still looking good? Awesome. The next and final progression is up to 3 sets of 10. If this continues to go well, then you are now ready to increase your weights to whatever's next to what you were doing. If we were working with 1 pound, we can work up to 2 pounds. If you were doing 1 plate at the gym, you can add another plate. However, when you increase the weight, you always restart your reps back to 1 set of 10 and start the slow progression of reps as we just described with the 1 pound. This increases the chance that you would be able to catch the swelling if it starts, and also not be overloading your still healing lymphatic system in the meantime. A side note, if you did regular weight training prior to surgery, you don't need to start with 1 pound. We recommend starting with about 50% of where you were. So if you lifted 10 pounds, start with 5 pounds. Everyone heals differently, but the window of time when the risk is the highest for lymphedema is typically within the first 3 years of your cancer surgery. Your risk after that 3-year mark doesn't go away. It's just less because now the lymph nodes are only having to deal with your day-to-day lymph fluid, not the extra lymph fluid that was present while you were going through all of your treatments. So be careful not to overload your fragile lymph system during this time period. Also, another important aspect to recovery is walking. Walking can help to improve your sleep, your mood, your appetite, and your overall energy, all things that can be affected during your cancer treatments. If you're not able to participate in a walking program, a stationary bike or water exercises are great alternatives. Studies have shown significantly reduced recurrence rates for those who are able to walk 30 minutes a day for exercise. You have to be able to walk fast enough, though, to elevate your heart rate. That's free and can be done anywhere. If you can't do 30 minutes yet due to chemo or other health issues, that's okay. Start with what you can do. 5 minutes, 10 minutes, then do that 2 to 3 times a day if you can, increasing the minutes every few days until you're able to work up to the 30 minutes at a time. We suggest keeping a log so you can track your progress. If you're currently or getting ready to start having chemotherapy, you're going to notice that you might have good days and bad days, but that's not a problem. Just listen to your body, do what you can on the bad or the weaker days. Make sure you don't overdo it on the good or your stronger days. Knowing that once chemo is behind you, you'll get your strength back. Just be sure to give your body the grace it needs to heal. It's been through a battle. Well, that's all I have for you today. I hope you don't feel overwhelmed with all this information I just gave you. However, if you still have any questions left after all this, there's going to be a slide at the end of the video, and that's going to have our contact information on it. And remember, listen to your body during your recovery. You know it better than anyone else.